Hello everyone, today we're going to learn about the ECG grid. This is the most fundamental thing that you can learn prior to start learning about the electrocardiogram waves. So you can see there are two waves here, two axes I should say. To the horizontal plane we can see time measured as seconds, and to the vertical side we can see amplitude measured in millivolts. If we take one small box, we can see the height equals 1 millimeter. And this is very important because when we're trying to figure out if there is hypertrophy or if there is ischemia or ST elevation MI, we have to count those boxes. So remember, one small box equal 1 millimeter. So the first step that we have to do prior to start reading the electrocardiogram is we have to make sure that it is standardized. You have to find this sign that is located to the left side of the ECG, and it should measure 1 millivolt or 10 millimeters in height. If that is not present, you have to make sure to make a standard, because then you might miss hypertrophy of a chamber, or you can overdiagnose it. Okay, so important, make sure that the ECG is standard to 1 millivolt of height. So these two examples, I brought them here just to illustrate the importance of understanding the amplitude of a wave when we're diagnosing low voltages or hypertrophy. In the top panel we can see that the QRS voltages are small in the limb leads. So this is this is suggestive of low voltages. So low voltages has a broad differential diagnosis that goes from pericardial effusion to infiltrative diseases. So as you see, only with knowing the amplitude of a wave we can narrow a diagnosis of a patient. So in the second panel we can see that the QRS voltages surpass 11 millimeters of height. That is the R wave, or the big spike in lead AVL, and this is suggestive of enlargement of the left ventricle. Once again, two good examples to illustrate the importance of understanding that the amplitude of a wave can give us a lot of information. So now we're gonna move to the horizontal plane, and as you can see here, in one small box we have 0.04 seconds. So if we have a big box that is composed of 5 boxes, you have 0.2 seconds. And for the same token, if we have 5 big boxes, you have 1 second. And this will come in handy at the time when we're gonna learn about the time that it takes to depolarize a wave, or if we want to know the time that a pause occurred, or if we want to know the heart rate. So learn this basic stuff, that if you nail this down, it will be more easy for you when you start to read the electrocardiogram. So in this example, we can see that in the top panel we have the QRS, and those are the narrow spikes, that they are less frequent when compared to the lower side. So that's the reason that we have a 60 beat per minute in the top ECG and 155 beats per minute in the lower ECG. And that is because of the frequency of the QRS complex occur. Remember that the QRS complex represent the ventricular depolarization and the time where the left ventricle pumps blood to the systemic circulation. Okay? If you don't remember that, don't worry, I'm going to discuss that in another video. So in this other example, you can see that the waves, the two waves, have different arrows. The first one has a small arrow because the depolarization was very fast. So with knowing that, you can make an assumption that probably the wave comes from a supraventricular origin. Now, if you see the second wave, you see that the arrow is prolonged, meaning that the depolarization took more time to occur. And this may be seen when the depolarization comes from the ventricle, or if there is a conduction block. And that, with knowing the time of the normal depolarization, we have a lot of information. So nailing the basics will give you a lot of information. Okay, remember, horizontal plane is in the measuring time. We are measuring time. So the key points for this lesson: first, remember to look for the standardization. Always look to the left side of the electrocardiogram. Look to the symbol that should measure 10 millimeters in height or equal to 1 millivolt. If that is not present, go to the settings section of the ECG machine and make sure to put it that way. Second, remember that to the horizontal plane you have time, and that will help you a lot when measuring heart rate, to know the time that a wave would depolarize, to know the time of a pause if there is any conduction problem. And lastly, remember that the vertical axis will measure amplitude, and knowing the amplitude will help you know the if there is a chamber enlargement, or if there is low voltages, or if there is criteria for myocardial infarction that I did not cover here. But nail these fundamentals and you will see that reading ECG will be more easy. So thank you very much. If you stick to the end of this video, please send your feedbacks. That will really help to grow this channel. And if you have any other question, go to thepuresegment.com. There I have a blog that covers all the information I just talked about in this video.